There is a lot of confusion around original Medicare versus Medicare Advantage. And in today's presentation, I am going to make it clear an honest comparison between the two and how you can choose the right plan. Let's get right into it without any delay. So, to get us started off, here are the statistics you need to know about. There are 54 million plus people that are enrolled in Medicare Advantage. That translates into 67% of all Medicare beneficiaries that are choosing Medicare Advantage. And the average Medicare Part B premium in 2025 is $174. So, why does this choice matter? Well, choosing the wrong plan, the wrong Medicare plan, whether you're choosing original Medicare Advantage, can cost you thousands in unexpected bills. And most people pick Medicare Advantage without really understanding what they are trading away. And so that's what I wanted to make clear today. So let's look at the two options you have when it comes to Medicare. When you turn 65, you have to choose Medicare because that's the healthcare plan that older adults are entitled to. Original Medicare is a government run program, it's been around since 1965. But Medicare Advantage is a private insurance alternative that bundles your coverage between Part A, Part B, prescription drug coverage, and in most cases, vision, hearing, and dental plans together. So, what are the big highlights between the two? Well, original Medicare is Part 1 and Part B is run by the federal government. You can see any doctor that accepts Medicare anywhere in the country. There's no network restrictions, which is what makes it attractive to a lot of older adults. And here's the part that a lot of people don't know. Original Medicare only covers 80% of what you need. You will have to get a separate Part D plan and sometimes Medigap plans to help you cover deductibles, out of pocket costs, etc. Then you look at Medicare Advantage, and rather than having Part A separately, Part B, and a separate Part D, and then a Medigap plan, Medicare Advantage puts all that together. It's a private insurance plan. It replaces Part A and Part B. And as I mentioned earlier, it often includes Part D and some extras like dental care, which is important, vision, and hearing care. But the biggest difference is that you have to stay in the plan's network, right? And so that's what some people prefer original Medicare. But there's trade-offs, regardless of what you choose, there's trade-offs. So let's look at how it unfolds during the year. When it comes to signing up for Medicare, you have a couple of windows that you need to be aware of. There is the initial enrollment period. That is when you first sign up for Medicare, 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after, you are guaranteed Medicare plan if you sign up during that window. And then each year, plans change. And so you're given an opportunity to review your options and switch plans or stay with your plan, but to an opportunity because every year plans reset. And so, you don't want to automatically just keep your plan rolling because guarantee you changes have happened to your plan. And so it's important to go through the annual election period, which is called the AEP, and review your plan. You can switch between original and Medicare Advantage, or you can change your Medicare Advantage plans. Now, there's another window called the Medicare Advantage Open Enrollment. It's from January 1st to March 31st, which is what we're in right now. Now, if you're in a Medicare Advantage plan, you have an opportunity to switch to another plan, or you can switch back to original Medicare. So that gives you another period to make a change, right? And so that is really important for you to consider, especially now if there's been surprises to your Medicare plan, or if you're not happy with it, or if things are not the way you thought they were going to be. This is your opportunity to switch, and I will give you how to do that and a resource that can help answer your questions. So if you have any questions about Medicare and you haven't been able to get a clear answer, I can share a free resource with you at the end of this video that can help you answer your questions. Then there's the Medicare guaranteed issue. It's a 6-month window when you first enroll in Part B, and it's the only time insurance cannot deny you or charge more for pre-existing conditions. That is pretty key, and I'm going to tell you why very shortly. So, what plan is right for you? What matters most is what you need and that the plan that you get satisfy your coverage. So, the big picture here is that original Medicare is about freedom, Medicare Advantage essentially is about savings, right? Original Medicare is best for people who have chronic conditions, they travel a lot, and so want to be able to use their Medicare plan in around the country, and they need to see a lot of specialists for conditions that they have. Whereas Medicare Advantage is for people who are healthy, budget conscious, and need local care because you have to stay in the network in your local area that the plan covers. So, in terms of advantages, obviously, Medicare, original Medicare, you can see any doctor who accepts Medicare. You don't need referrals, or prior authorization. Well, and that is changing in some states. Yes, some states are now going to require prior authorization for original Medicare, but that is only 6 states. In the rest of the 44 states, you can still get your original Medicare without prior authorization. Excuse me. There is a national network, right? And so it's ideal for travelers, especially those who are snow bunnies or people who travel around a lot to see grandchildren, to see their kids, or they just, adventurers that need to be able to use their Medicare plan anywhere in the country. You can pair it with Medigap to be able to then get predictable out-of-pocket costs. And usually it has higher monthly premium, but you have a lower risk. And then you go to Medicare Advantage, you may get a zero plan often. There's no monthly premium. It includes dental, vision, hearing extras. You get your draft coverage also bundled into it. So you get just one bill, but you must use in-network providers. And usually they have lower premiums, higher out-of-pocket cost risk. So you have to weigh the two to decide what is really your goal. Is it to be able to have the flexibility to see specialists without prior authorization, to use your plan anywhere you want? Or is it about saving money and having one bill that bundles all of it together without you having to go find your own prescription drug coverage, and then you have to cover your hearing, dental, and your vision plans? So I'm going to give you a 5-step decision plan on how you can think about all of this, right? Check your doctors and medication first, because any plan you choose, you want to make a list of your doctors that you see and the medications that you take, and verify that your Medicare Advantage plan network and it's going to cover that, right? And then compare annual costs, not just total cost, not just premiums, because premiums can be very deceptive, but your cost includes copays, deductibles, out-of-pocket cost maximum. Put all that together and compare the two plans. And then your health status is a big deal. If you have chronic diseases, if you have pre-existing conditions, if you need specialist care, then you may want to look at original Medicare plus a Medigap plan, because that gives you the biggest flexibility. And then if you're traveling a lot, Medicare Advantage plans may not be the right thing for you because they have restricted local networks. And if you're in multiple states, you may not be able to use your Medicare Advantage plans because it is locally based, sometimes to your state, to your region, to your county. And then the government has a Medicare website that is very robust that can help you find and compare. It's called medicare.gov/plan-compare. And that website is very useful for you to go in there, put in your zip code, and see what the plans that are available to you, how much they cost, and be able to compare your Medicare Advantage and original Medicare plans. But here is the big deal. People make big mistakes that cost them thousands and thousands of dollars, sometimes permanently. And you don't want that to be used. So let's run through the four biggest mistakes that I see that people make. Number one is that they're choosing plan based on just the monthly premium without thinking that, for example, Medicare Advantage plans could cost about $8,000 in a bad year that you've had many health issues. So you have to look at the out of pocket maximum cost and see if that's something you can afford. If something unfortunately happens, that you may need to use your plan a lot. And then your Medigap window. As I said, that's the part where they cannot deny you coverage, right? And so your 6 month one-time Medigap window, do not lose it, because that is when you can lock in into a good plan if you're on original Medicare and not be denied for pre-existing condition. And if you're on Medicare Advantage, there are network restrictions. Not every doctor is going to be in your Medicare Advantage plan. That is the biggest surprise that people get, is that they sign up and then they realize that their doctor is not in the plan. Their hospital that they need to see, especially when you live in rural areas or you have to drive a lot to go to the hospital, that their hospital that they want or prefer is not in their network, right? And then not checking your drug formulary. Your medications might not be covered or could be on a higher cost tier. So that's also important when you're comparing plans, because there are surprises and I hear this all the time. And that's why I want to make sure that you are covered. So what should you know? How are you going to make a right decision as you look at your plan right now during this Medicare Advantage open enrollment period? That gives you another opportunity to reevaluate your options. And if there are any surprises or you are unhappy, compare the total cost, check your doctors, and plans for the worst, so that you know that if the worst thing happens in terms of health challenges, how much is it going to cost you total, whether you're on regional Medicare or Medicare Advantage? And that is what you should be looking at, right? Because that is essentially the key driver here. So if you want to really stay on top of all of this, if this or some of this was news to you, or you want to just be on top of everything and be updated on everything that's happening in and out of Congress that can affect your benefits, then sign up for my daily newsletter. Monday to Friday, I send you a short newsletter that highlights the three things that you need to know today. Go to benefitsinsider.co, enter your email address, and then tomorrow you start receiving the daily 3 newsletter. It will give you 3 things you need to know today in very bite-sized chunks that is very easy to read, but keep you informed and knowledgeable and ready. So go to benefitsinsider.co. I'll put the link in the comments. But I'm also on a mission this year. I want to help 100,000 older adults get peace of mind about Medicare. Why am I doing this? Because of what I just talked about. There's a lot of mistakes that people make that cost them a lot of money. And in today's economy where every dollar counts, it is very heartbreaking to see people make common mistakes that could be avoided. And not only am I trying to help 100,000 people, I'm trying to save you $5 million in total this year. So right now, as we speak, I have saved my audience that have listened to my advice $1.4 million on our way to saving 5 million. And I'm doing that with partnership with Chapter Medicare. Why Chapter? Because here's the thing. They have helped so many people that have taken my advice and called them. Here's Celestine saying, I called Chapter yesterday, and they do tell you everything you need to know. Even if you get to ask certain questions, they will inform you all the things that you need to know. So even if you didn't get to ask all the questions, they will lead you in the right direction before making a decision. They know everything and can help you. Please give them a call. You'll be glad you did. Here's another one from Craig. I called Chapter last night, and the support person was very efficient in finding a new and correct Medicare Advantage plan that meets my needs in the best way. The support rep also kindly sent me via email the instructions to enroll in the chosen plan. This morning, I used those instructions when I was on the Medicare.gov website. It all was a breeze. As a follow up, the chapter support person said he would check the 2026 plan in about 7 days. I enrolled in, to verify that I did it right. I am very happy with Chapter's fantastic support and would highly recommend them to anyone who needs help to select the best Medicare medical insurance plan that meets their needs. Guys, these are people who, like you, have listened to my advice and call Chapter to get that peace of mind that I'm talking about. So you can be the next person getting that peace of mind, getting your questions answered about Medicare to make sure that the plan that you have chosen, it meets your needs, right? So if you have any questions or you're worried about surprises, this is the time to get those questions answered. Call 539 205 2147. Or if you want them to call you, then go to askchapter.org/insider and they'll be happy to give you a call and schedule a time with you. They are A plus rated with the Better Business Bureau. I have read all these fantastic reviews from people like you who have gotten their questions answered about Medicare and gotten that peace of mind that I am trying to get 100,000 people this year to be able to get, because it is that important. Peace of mind about Medicare is going to save you money and make sure that you feel confident in the Medicare plan that you have. So give Chapter a call today, 539 205 2147. I'll put all that information in the description and in the comments to this video. So thank you for watching. And I appreciate all of you. If you like what you heard, hit the like button, hit the subscribe button, hit the notification button so that every time I release a video, you'll be the first to know. Thank you for watching.